I'm Amanda Olson from IntimateRose.com, and I'm a physical therapist specializing in pelvic floor rehabilitation. And sometimes we get questions about why are the weights extremely painful to insert or to use. If you are experiencing pain inserting the weight and it didn't get better using just a little bit of lubricant on the tip of the weight, there could be a few factors at play. The first scenario is that if you are at an age after menopause, the estrogen levels in your body are very low, and that can lead to thinning of the vaginal walls and some vaginal dryness. So the weight can be uncomfortable then. And so if you have tried using just a little bit of lubricant on the weight and it's still not comfortable, it's probably a good time to have a conversation with your physician or other healthcare provider about the possibility of using some form of medication to help with that vaginal dryness. And it doesn't have to be a medicine that you take orally. It could be something that you apply directly to the tissues. But that's a good question for your healthcare provider. The other thing that can be happening is very similar, but in women who are nursing after delivering a baby, the same thing happens to estrogen levels. They decrease and there's vaginal dryness and the walls of the vagina can become thinner and it can be uncomfortable. So you can use a little bit of lubricant or you can wait until after nursing and try again to use the weights. The other thing that can happen is that there can be knots in the pelvic floor muscles themselves. So the muscles are everything that you see in red here, the superficial layer and the deep layer. And they're muscles just like everywhere else on your body. So the same way that you could have a knot or a trigger point in your neck or your back, and you can push on it and it sends kind of a zinging sensation up around your head or causes a headache. The same thing can actually happen in the pelvic floor, and that is a very treatable condition. A physical therapist specializing in pelvic floor rehabilitation can be very helpful, and so you can visit a physical therapist or your healthcare provider to get some help with that. For more educational videos, you can visit Intimate Rose at YouTube or at intimaterose.com.